Are you looking to find a speech therapist for your little one, but you're wondering how it is that you can find resources that are within your budget and price range while also finding good therapy? Well, you've come to the right place. Hi, my name is Amini. I'm a speech and language pathologist with several years of experience working with children and their parents to maximize speech and language development. I also have my practice in the Bay Area, Smarter Speech, where I do the same. And my mission with this YouTube channel is to empower parents and caregivers of young children, because this is when a child's brain is developing so rapidly, and just little changes that you make in the way you talk and play with your child can have huge implications for the way not just speech and language develop in the future, but also for how learning develops in the future as well. So going into our question, what are some of the ways that you can access therapy within your budget? Whenever you're looking at therapy, especially private pay therapy, you have to keep in mind the cost of living, the therapist's expertise. All of those things go into determining the therapist's hourly rate. But there are some things that you can do to lessen the cost that you yourself have to pay. The first recommendation that I have is, if you're choosing to go with a private pay speech therapist, and a lot of times that is pretty pricey, to ask for a super bill. So a super bill is a bill that a therapist generates usually once a month, and it has the list of services that the therapist did, talks about the location where the therapy was given. There are some diagnosis codes and procedure codes that insurance will need. And then there's a total of how much you paid that therapist for your private pay services. But when you submit this super bill to your insurance, depending on your insurance policy, insurance will reimburse you a percent of what it is that you paid. So this is not something that they'll do with the therapist. They will reimburse you directly, whatever percent it is. And that really varies policy to policy. Some people have great policies where, especially if there's a lot of demand or there's a lot of wait lists and scarce providers, they'll cover quite a bit of whatever it is that you paid. If your child has particular diagnoses in relation to speech and language, there's a higher likelihood that you're going to be covered for a significant portion of what you paid. You will have to pay the therapist week by week, but you will be getting that money back at least within a couple of months. And that's a really nice option to check out. So when you're looking at private pay therapists in your area, do not forget to ask for a super bill, not just for assessment, and also for therapy sessions themselves around once a month. My second recommendation is, if your child is under the age of 3, you can reach out to a regional center near you. So I'm a speech therapist in California, so I can talk particularly about the California process. You would have to look into what this looks like in different states. But basically, it's early intervention services for your state. So if you make a call to the early intervention services for your particular state or your particular county, then you will be able to find a number or an email to reach out to and to request an assessment. After that assessment, if your child qualifies for therapy, they have to be under a certain percentile to qualify, then you will qualify for weekly intervention or monthly intervention to help your child. Some caveats here, though: your child does have to score below a certain percentile, and the waiting list can sometimes be a little bit lengthy for services like this. But if your child is under 3, please look up early intervention services within your county, within the place that you live, and see if you can get on some sort of a plan or some sort of an assessment for your child. The third advice that I have, if you're looking for more therapy and maybe your child is not under the age of 3, is to take advantage of your local school district. Especially if your child is attending public school, you can look for help for speech and language within the school itself. There are some things to keep in mind here. First, you would usually talk to a child's teacher, see what your concerns are. And then the teacher will probably try to see if they can intervene or help within the classroom themselves, that is, with the teacher themselves. So they'll probably try to do this for maybe 6 or 8 weeks. And once they've done this, if they still feel that this is not something that can be addressed in the classroom, they'll talk to you and they'll schedule an evaluation with a speech therapist. So once that evaluation is scheduled, normally you give your speech therapist another 2 months or so to evaluate the child. And then once that 2 months has passed, you would have a meeting where you go over the results of the evaluation. So this will talk about what percentile your child is at, whether your concerns are something to worry about right now, or whether your child will grow into them, and whether or not they qualify for something called an individualized education plan or an IEP. This is, of course, for schools in the United States. I'm not sure what the procedure is in other countries, but in the United States, you can ask for this assessment at any time, and you can get that IEP meeting and the assessment to see whether your child qualifies. If your child does qualify, they would have a plan under the special education department of the school, and you would work on certain goals that the speech therapy provider suggests. So those are our main 3 avenues. In terms of other providers, you can also look into providers who are not private pay providers. They will be contracted with your insurance itself. So you would have to contact your insurance and get a list of providers that are contacted with your network, or that are contracted with your insurance provider. So those are the main avenues to look for therapy that can be a little bit more budget friendly. The last thing I do want to mention, a bonus tip, is if you are looking to help your child, there are so many resources out there for parents themselves to do the work themselves. It's not quite the same thing as having therapy, but if you want to supplement, or you're waiting and you're looking for some things to do with your child, there's a lot of resources out there. You can check out Teachers Pay Teachers, where they've got amazing worksheets and workbooks and things like that that you can use for whatever concern that you have. You just have to make an account. You don't have to be a teacher. You can check out Etsy for similar types of handouts and fun activities to do with your child. You can look on YouTube. And there's plenty of ebooks and courses out there as well, if that's something that you're interested in, to be a little bit more proactive in your child's speech and language journey. Speaking of which, we have those too at Smarter Speech. So you can just check out the link in the description box below. You'll find a link to our free mailing list, ebooks for all ages, under the age of around 6, 7, all the way up to 8. There's also a link to parent education courses, and you'll also find links to some materials that I recommend or suggest. All right, so those are some resources you can look into. I hope that you found this video helpful. If you did, please subscribe to get more speech and language tips, and happy talking.